So as you hear, we have a recording in process. This is Tuesday night weekly meeting of Shphrah Circle Community Doula Program. We have a wonderful guest speaker this evening, our gorgeous circle member, Midwife Tara. And I'm going to let her further introduce herself. Everybody's piling in. Let everybody come in. So we'll be doing introductions after the presentation as well, and reactions as we do with films usually. Okay, so it looks like everybody's here, and I'll be on the lookout for more people to let in. So, lovely Midwife Tara, how are you today? Go ahead and introduce yourself. Let us know what you've been kind enough to share with us for discussion this week.
Thank you, Samsara. So last week we watched the TED Talk where the doctor was talking about preeclampsia, and Samsara felt like since we had been touching on the subject and I had mentioned that I had a PowerPoint which talked about preeclampsia in more depth, she wanted to keep the ball rolling while everyone's thinking about preeclampsia and get this information to everyone as soon as possible. And I thought that made a lot of sense. So I'm gonna share my screen. So this is part of a class that I teach called Nutrition and Nurturing. And we're just going to do the part that really looks at preeclampsia for tonight. Did you want me to introduce myself? I have a little introduction slide.
Please introduce yourself.
Right. I'm going to skip to that. There's me.
Great picture.
Thank you. So my name is Tara Marikita Makua Compehos. One of the things I'm most proud of about myself is that I was born at home back in the 70s in Chicago, and my mama gets all the credit. It was a surprise breech 2 weeks post dates, and she did an amazing job on her hands and knees, and the physician who attended did an amazing job keeping his hands off the breech. So I'm proud of that. I grew up in Oakland and Berkeley in California. And then I got a fine arts degree from New York University before moving to Hawaii in 1998. Once I came to Hawaii, I studied Lomi Lomi, which is traditional Hawaiian massage with Auntie Margaret, and became a massage therapist. In 2002, I gave birth to my first child, my daughter, and I had a home birth, and the midwife who attended me was Medra. When my daughter was about a year old, I realized I was really excited and in love with birth, and what I was hearing around the community was like people talking about it like it was this horrible thing. So I started getting drawn towards birth work. So I told Medra I wanted to be a doula, and she was like, similar to Samsara, like some of the doula programs that are out there are just not really cutting it. So she said if I organized it and ran it, she would teach it. So we did this really awesome doula training. And that same year, I was pregnant with my son, my second child. That turned out to be an unattended birth. So a lot of midwives are very against unattended birth, but I believe that it can be a wonderful thing. It all depends. I do support people in that choice. And then I realized I didn't want to just be a doula. I wanted to be a midwife. So I started my apprenticeship in 2006, and it was an unusually long apprenticeship. I stayed in that work with her for 6 years. And somewhere in there, I learned about this thing called a CPM, which I didn't know about at first. And I was like, oh, that seems like a good idea. Maybe I'll become a CPM. But the school that I chose to attend, the Matrona, is not accredited by MEEC. So I wasn't able to do the MEEC accredited pathway. In 2013, I spent that year. And I want to quickly say a lot of people feel like the Matrona is like a throw it all away, anything goes, irresponsible program, but Wappiel Bartlett teaches the didactic parts of midwifery with a lot of integrity. And, you know, it's correct, it's rigorous, it's a really good training program. And I also went to the Philippines and did an internship with Mercy in Action that same year. 2014, the next year, was when licensure started to be pushed for midwives in Hawaii. And so I have been involved in birth activism and reproductive justice advocacy, especially in this state, since that 2014. In 2019, a law was passed for licensure for midwives, and a task force was created. I was the vice chair of that task force. And I authored the report that task force produced. In 2020, I began reproductive justice grant writing and organizing. And in 2021, I became licensed in the state of Hawaii. In 2022, I believe it looks like I will become a Louisiana licensed midwife as well. So that's a little bit about my background. And now going to preeclampsia. So we're going to focus on preeclampsia tonight. I'm just going to launch right into it unless anyone else wants to say something right now. Okay. So Dr. Brewer was a medical doctor. He worked in what's sometimes referred to as the toxemia belt in the 1940s and 50s. So that's basically like across the South in the United States. Many women were having seizures during pregnancy and no one could figure out the cause. So he finally figured out that, you know, the people in this area were malnourished. And so the women's blood volume was not able to expand as much as it needed to. So when you're pregnant, your body needs to make 50% more blood than it had before you got pregnant. And these women's bodies were not doing that. So this was leading to all kinds of metabolic problems, which create the symptom picture that doctors now call preeclampsia or toxemia. So during pregnancy, like I said, your body has to make 50% more blood, and the ingredients that the body uses to make blood are protein, salt, and water. Protein and salt have to be present in the bloodstream in order to hold the water there. So if there isn't enough protein and salt, the water seeps through the wall of the blood vessel and into the tissues, and that's what causes swelling. So these pictures I like, not just because, not just because they're pictures. Well, anyway, I like it because it shows, so osmosis, right? Like in middle school, we all learn about osmosis. It's basically the ratio of salt and water. And you've got the membrane, you've got the wall of the vessel. And if there's more salt and less water on one side than the other, it's going to go through the vessel until there's a balance. So that's what's going on there, is that there's not enough protein and salt in the blood to keep it in the vessel. And so it's moving through the wall with that osmosis process and becoming edema, swelling in the body. Another thing, so this picture is nice. It shows the blood moving through the vessel, but truly when blood is moving through our blood vessels, the heart is pumping, right? And the heart is constantly responding. Blood pressure is not a static thing, right? The way our heart beats is constantly responding to the world around us. If something's stressing us out, or if something's making us happy, or if we love someone near us, or if we're near the ocean, our blood pressure is changing. And what's so cool is that the blood isn't just like slugging through, it's spiraling. The blood is like spiraling through the veins. So it's really this like beautiful, our bodies are these amazing, beautiful poems. So progesterone, which is one of the pregnancy hormones, reduces the tone of all the smooth muscle tissues in our body. That includes our blood vessels. And the reason it does that is so that the blood vessels can accommodate more blood, right? Like, so they're not all tight with too much blood going through them. The progesterone reduces the tone so that more blood can go through and it's not making your blood pressure go up. But if you don't have more blood, now the tension ratio between the wall of the blood vessel and the amount of blood is too lax. I hope that makes sense. Please let me know if anyone has questions. So the liver is this amazing organ, which is responsible for over 500 metabolic functions. So everybody, let's take a moment right now. Your liver is in your upper right quadrant of your torso, of your abdomen. It's kind of under your ribs there. Let's just place our hands on our liver and thank it for everything it's doing for us right now and every day. Please remember to thank and love your liver every day. In pregnancy, it's working even harder because the liver is what turns protein and salt and water into blood. So it has to make that more blood. It makes more blood even than normal. It's also responsible for cleaning toxins out of the blood. But it doesn't just clean toxins out of the blood, it also cleans everything that needs to be cleaned out, even normal physiological things like hormones. The liver is what cleans them out of the blood. So it's working harder to make more blood. It's also, you have higher levels of hormones in your bloodstream when you're pregnant, so it's cleaning that out. That's more work. And if it's not supported with a well-balanced diet, or if it's overloaded with toxins, so that could be like prescription drugs, environmental pollution, preservatives in our food, all those little words on the label that you can't pronounce, your liver has to deal with all those things. And it can become stressed from too much of all of that, and too little nutritive support. So if it's stressed, if it can't make enough blood, if it can't make enough albumin to make the blood, albumin is the kind of protein that the liver uses to make blood. So if it can't make that, then there won't be the right pressure between those vessel walls and the amount of blood in there. These pictures, by the way, are Alex Gray. He makes these beautiful, beautiful pictures of the body. So we've got our beautiful heart here and the kidneys in this picture. And we're looking at this whole metabolic picture. So if the blood volume doesn't expand, the body reacts the same way it would to a hemorrhage. Like if someone gets a limb chopped off and they're losing like a lot of blood, or postpartum, they're losing a lot of blood. The body is going to react the same way. If there's not enough blood in the system, there's not enough blood in the system. It's going to start pumping. That heart there that we see in the picture is going to start pumping harder to try to get the blood moving through. Then the kidneys, so the kidneys release renin to constrict the blood vessels. The kidneys are trying to increase the blood volume by reabsorbing the water and salt, which they usually filter out and release from the body in urine. So until you give your body the protein and salt it needs to make more blood, the water just keeps seeping out and making you swell and perpetuating this cycle of metabolic crisis. So these are kind of the 3 cardinal signs. Last week, Samsara was telling us there's 5, but these are the ones that usually these 3 are the ones. And now it sounds like they're even just going with the one, the high blood pressure.
That's what I was recently told by a doctor at Highland that, oh, I haven't read the recent information. And I also haven't seen this recent information. I've been looking for it. But I'll just say that a doctor did say to me that now hypertension is that's the only marker, and they can declare someone preeclamptic from just that. Nothing else.
So that's crazy because blood pressure, like I was just saying, can go up and down a whole bunch of times throughout the course of your day. I mean, if you're jogging, it's good that your blood pressure went up, right? It's supposed to go up and down. So one thing that Wapio taught us is like, don't just look at how high it can go. Let's look at how low it can go. So if a woman comes to me for prenatal care and her blood pressure is high, I will usually give her a chance to drink some water, because dehydration can make your blood pressure high. Lay down, make sure her feet, as somebody in this group was talking about that she has her feet solidly planted on the ground, that she's not sitting on my massage table where her feet don't reach the floor. And maybe give her a little massage, and then let's see, because if someone really has preeclampsia, their blood pressure can't go down. That's the problem. It's not the fact that it can go high that's problematic. That's normal. It's the fact that it can't go down. So if you can get it down to a nice normal number, then it shouldn't be, it's not preeclampsia. So the 3 cardinal signs that used to be the guideline are the pregnancy-induced hypertension, which means high blood pressure. The liver is stressed by too little nourishment and or too many toxins. There's not enough protein and salt to expand the blood volume. That leads to the blood pressure going up to try to get that limited blood supply circulated throughout the body. Oliguria is a fancy word for not enough urine, not peeing enough. And the thing is protein in the urine, right? So the kidneys are reabsorbing the water and salt because they don't want to let any more of that out of the system. The kidneys are filtering the blood, and usually they're letting those out of the system, but they're like, they got the memo from the heart and the liver, and they're like, oh my gosh, we don't have enough blood. Let's keep all this water and salt. Let's try to keep this system with as much in it as we can. And so you're not peeing enough. Now, what happens with the protein in the urine is that with that higher blood pressure, it's pounding. And so protein molecules are usually too large to pass through the filter of the kidney. They don't go through, they go back into the circulation, the salt and the water go out. But when the blood pressure is higher, it can be so hard that it's actually pushing those larger protein molecules out, and that's why you're seeing them in the urine. Once again, just like the blood pressure, there can be reasons that are not pathological for seeing a little bit of protein in the urine. It could be discharge. Vaginal discharge has some protein in it. She might have had sex with her man the night before. Sperm registers as protein on a urine test strip. So there might be a little bit of blood. That isn't necessarily a concern, but large amounts of protein in the urine are usually from the protein going through the kidney and showing up in there. And if it's consistent. Okay, and then we talked about the swelling. I think everybody gets what causes that swelling. So those are like the signs. Okay. So there's this really beautiful picture of this baby with its placenta, and then you see a plant with its roots. The reason your body is making extra blood in pregnancy is to have enough to perfuse the placenta, to have enough blood to fill your whole body with all the blood it needs, plus to fill that placenta so that your baby can be fed and oxygenated. And so the metabolic imbalance of preeclampsia can jeopardize the health and the wellness of your baby. So true preeclampsia is dangerous for mothers and babies, for sure. We don't want to downplay that at all. But the good news is, so the good news is that most of the things that are scary about pregnancy and childbirth can be completely avoided by eating plenty of salt and protein and drinking enough water. It's a really simple solution for a complex problem. So when I say eat plenty of salt, I mean good salt, not regular table salt. So kiln dried salt is dried at 2000 degrees centigrade, which destroys the trace minerals and reduces it to sodium. It's just sodium chloride. So these two pictures on the left, that's what that is. Actually, all of these are that. And now that consumers are looking for better salt options, companies are sometimes making packaging kind of deceptive. Like those two on the left, it says sea salt, right? And it's got this pretty picture of the ocean. It says from a natural source. So they're trying to kind of make it seem like it's sun-dried. But if it's plain white and super dry, like normal salt shaker salt, it's kiln dried. So two things, look at the color and consistency and look for the word sun-dried. I won't buy salt if it doesn't say sun-dried on the package somewhere. So here's some pictures of what that looks like. It's dried at lower temperatures, so it retains the iodine, magnesium, and over 80 other trace minerals. And then I just want to say, preeclampsia isn't just about nutrition. Nurturing is an important factor as well. We have a deficit of excellent nutrition, but we do have a deficit of nurturing our pregnant mamas as well. I'm going to go back to this slide that shows Gloria LeMay's quote, since we're talking about it. This is Gloria LeMay. She's a traditional midwife from Canada. And she says, the only two things that have ever been proven scientifically to make a difference in producing healthier babies in the general population are improving the nutrition of the pregnant woman and improving the social support of the pregnant woman. These two areas are dismissed in the professionalization of childbirth treatment, but are contributions that midwives, birth attendants, and doulas can provide in their work. So I believe part of the maternal health crisis we are facing right now is the fact that our medical system only looks at pregnant people as bodies, and that you really cannot create true health if you don't understand there's a soul and a spirit and a mind in there.
Exactly. Exactly.
So before I finish this, I just want to see if anyone has any questions.
So let me just say that we do want to move on to
down.
Okay, that is somebody's dog being corrected. We are going to move into questions. I will shut up in a minute. I want to tell people to not check in now. we'll just do questions and then end the recording, and then you guys can check in with some privacy. Everybody in YouTube need to know your business unless you tell them. Okay, so so let's open it up for any questions. There were a couple of things in the chat where I was telling people, wait till the end. Now's your time.
Okay, yeah, I didn't even look at
Yes.
that.
Hello. Hello.
Hi.
I
Hi.
had a question Hi, I had a question quickly. So I just so I'm clear, you said that preeclampsia is only when it presents itself during pregnancy, the only way it's like diagnosed is if you have hypertension.
That is what the doctors are saying right now. What Tara said was more complete, and what I said was more stuff. There's actually a longer list of things that could be an indicator of preeclampsia. But, and again, I want to be really clear that this was told to me by one doctor. I haven't read it anywhere else. And I've been researching it since that one doctor at Highland said it to me. But that seems to be the way they're rolling. If you have hypertension, and especially if you're Black or brown, and you have high blood pressure, they're going to put that label on you.
Right, because I know sometimes preeclampsia presents itself during pregnancy and they don't have high blood pressure.
It's true.
There you go. That's a really good point.
That's a very good point. So they're missing
Yeah,
all
so that's-
those cases.
Yeah, I'm just kind of confused because it's like, I know a few births I've seen, they did not have hypertension, but then during childbirth, preeclampsia was an issue for them. And we had to, well, the doctors, because it was a hospital setting, they
Right.
had to issue the anti-seizure medication during pregnancy.
And that really got to the end of the, because nobody's caught it, here's a mom seizing.
Right. So
Yeah.
preeclampsia means, eclampsia means seizures, right? So
Right, eclampsia.
preeclampsia means we're worried that this could be leading up to seizures. But if they're actually having seizures, that's a situation
That's
that got
eclampsia.
way out of hand. Somebody was not, that mother's situation was not being properly monitored.
At all. At all. I'm very sorry. How did things go for that parent?
Well, it wasn't, they were seizing, they were about to seize during delivery. So it like, the doctor was really like on top of it just because this was her third birth. And so when she identified that there may be a problem, then that's when she administered through the IV, the medication, the anti-seizing medication. So the whole pregnancy went without any, without a hitch. And then during delivery, that's when they identified the preeclampsia.
So I wonder how they identified it. Like, how did they know she was about to have a...
Just because the previous birth, there were some issues. And so she let that be known during her like initial, check-in with the physician. And so the doctor was like, okay, well, we're going to treat you for this preeclampsia. We're just going to be proactive because you may be a candidate for somebody. I mean, you may experience some issues during delivery. So, yeah.
So it still doesn't sound like...
I don't know if that makes sense.
It doesn't, because it doesn't. It's not how you're telling it. The story doesn't make sense.
So so during delivery, the mom experienced elevated high blood pressure.
Right.
And so when that was happening, the doctor then said, okay, well, we need to be proactive in this so she does not seize during delivery. And that's when they said, okay, well, we're going to go ahead and they noticed that her blood pressure was going up. And that's when they administered the medication for the anti-seizing.
Okay. So I
Does that make sense? I'm sorry.
It's okay. I believe I heard you clearly several times, and you're doing a good job of telling the story. And there were other signs other than high blood pressure. I could imagine that could have clued this physician off that this client was not doing well. Do you know what I mean? Yeah, they treated it once it became apparent once they had that high blood pressure, but there were probably other things going on. And of course, we'd have to see the client's charts and things like that. And you said there was a history as well, correct?
Yes, this was a third birth. So the first time that she wasn't treated at all, and that could have been very detrimental. And then the second time she was treated for it. And then the third time the doctor was like, okay, well, you know, since the times before it wasn't acknowledged, we're going to make sure we keep an eye out for it.
And it still really wasn't. So I think the important takeaway from what you're sharing with us is how important diet is, and it is why we stress it the way we do, because it has no one can say 100% anything, but what I see with multips, folks have not, having their second, third, fourth baby, is that, it's harder to take care of yourself with the second, third, and fourth babies. People always talking about, well, the second baby comes earlier. The second baby comes earlier because there's a first baby that the mom's running behind, and she's not taking care of herself as well, and she's stressed out more, and even if she's very lovingly looking forward to her second child, it's more challenging when you have no community or typical U.S. community, and a new baby coming. So would you agree with that, Tara?
Definitely. And when we get into our like grand multiparas, I mean, every time you give birth, your body goes through this, like, it's wonderful, it's beautiful, it's transformational, but it does take a little bit more salt out of the earth, so to speak. So to replenish all of that requires a lot of nurturing, a lot of care, and you're nurturing and caring for your baby. So yeah, so like you're saying, Samsara, like without that village to replenish the mother every time, there will be a little more vulnerability to metabolic imbalance with subsequent birth. And I think also the takeaway maybe from that story is like pregnant people in the medical system that we have in our country right now are walking this fine line between getting into a metabolic situation that's dangerous for themselves and their baby, and being misdiagnosed and then treated for something that's not actually going on. So like we as doulas really, really can help people navigate this and ensure their safety by really helping them understand the importance of nutrition and that social support, and like knowing what's going on with their body and doing something about it right away, keeping on top of it. Did anyone else have any questions? Thank you for your question.
Yes, thank you for that information as well. It's a good learning moment.
Hi, Tara. I did put in the chat my question, but I just noticed that for a lot of women who experience infertility, that it was suggested to get progesterone. So I was just curious if that's the reason why. Not all women, obviously, but those unknown cases that happens around that time, if that could be a cause for the miscarriages.
Yeah, so progesterone is really important in the implantation process of pregnancy. And so a lot of times that is one of the big reasons why some women will miscarry, is because their body isn't giving them enough progesterone to get that implantation really well done. And so that's why progesterone is helpful. Does that answer your question?
Yes, thank you.
Any other questions, folks?
I have a question. Thank you for bringing this topic in another set of words and reasoning, because it is, I think, like really out there in people's experiences, and the way it's talked about makes it is complex, but like it makes it more confusing sometimes the way they discuss it, like in a clinical setting. So I had two questions. One is just kind of given like all these feedback loops, like the liver's doing all this work, the blood volume's increasing, when the liver has to do extra work for whatever reason, there has to be more blood activity, more circulation, more volume. If there's not enough nutrition, that circulation doesn't function well. So there's like all these different pieces. One question is, given that like nutrition and social support can address so much, is that also why kind of like the establishment acts like, oh, like there's no cause for preeclampsia because it can start in all these different ways? Like it can be a lack of nutrition, or it could be chronic stress and high blood pressure that then leads to behavioral changes that mean lower nutritional adequacy. Like, is that kind of, because it's like this social and biological experience, is that kind of why medicine is like, we don't know why this has happened, even though like we do know why?
Well, that's a good question. And I appreciate you bringing that up because it sounds like, I mean, to me, in my experience, instead of asking a question, you're kind of giving me a little bit of like, oh yeah, that's probably why, because they don't like, you know, many of you know, I'm dealing with the medical system for a completely different reason, for my own health. And they're just like, oh yeah, nothing, it has nothing to do with food. You know, like cancer has nothing to do with food, and there's nothing you can do nutritionally to like make it better, or you know, like for what do you nutrition in chemotherapy, and they're just like, yeah, just eat whatever you can, you know, it's like just like that. There's no place for, and then you have nutritionists, right, who work in the medical system, but they really have just these like sort of stock answers, like eat a lot of protein for healing. So I think, yeah, it's just like an area of their system that hasn't been built out very well. But I love that you're also saying it's got all these different factors and none of them are really acknowledged in that system, right? Like nutrition, social support.
Yeah. It seems like the reasons are there, and we just, it's not something that you can fix with a quick fix or a quick visit. And that's maybe, it's like, we don't have a reason that we can address with a prescription or one clinical visit. So
yeah,
therefore there's no reason this is happening.
We have a whole host of medications for it.
Right.
And so we're going to throw those at it. I was at a birth early this morning now, and the mom, she's pushing and she wanted to vomit, which isn't that normal? Like people having a baby pushing? What did the nurse say every time she wanted to vomit? You want some Zofran? We'll give you some Zofran. And and she's confused, and I'm like, it's normal to vomit. Actually, it helps the baby's dissension. Good puke is yay. But the nurse, of course, nurses are looking at me like crazy because their training is all these things. You know, a cup of ginger tea is not good enough because some company can't patent the ginger tea and make money off of it, even though it could totally clear up, you know, not in birth, but you know, you can't patent ginger tea. So that there's that whole thing around, you know, what happened 100 years ago, and you know how allopathic medicine became appropriate and valid, and everything allopathic, natural, powerful, anything your grandma would have told you to take that's all quackery.
Yeah, I love how you use the word appropriate there, because, and to me, that is white supremacy. This one white way of doing things is the only appropriate way of doing things. And that's still today, the medical system.
Wacky.
Also, I think that TED Talk we watched last week kind of helps with what you were talking about, Jocelyn, because it's like, at some point somebody was like, it's the placenta. And then everybody was like, okay, it's the placenta. And they stopped considering other options. And like, I'll just say, like, I guess maybe they're mad at the placenta for wanting to feed the baby. Like, that's the only way that makes any sense. Like, yes, the placenta needs to be perfused with blood. And so I guess you could say that's.
Yeah, I had to miss last week, so I'd like to watch that. So maybe, hopefully this question isn't redundant given that. My other question was just so I understand, when when you're in a situation where someone is being assessed for a preeclampsia diagnosis, when they test for the platelets, is what they're testing for is there enough protein structure in the blood to keep circulation working the way it's supposed to, and what they're testing is if that platelet or those protein structures are like there's too few of them or too small of them. Is that what the platelet count is, or is that a separate thing?
I don't work in that system very often, right?
Yeah.
Like I work in my system, the home birth system. So I am not totally sure, but my guess
I
would
might be confusing it. I think they say they're testing for protein in the urine, but then they also talk about
wait,
platelet counts. That might be for HELP syndrome, which is like, I guess, this and something else. I'll look it up.
so the protein in the urine we talked about, the platelets are in the blood. So the only thing I will say about platelets is like, so the eclampsia, right? What causes the seizures? I didn't really talk about that in my presentation. And that's if this metabolic whole imbalance situation that we did talk about, the heart, the kidneys, the liver, the blood volume, all of that continues to spiral out. What ends up happening is that the blood in the vessels doesn't have those right ratios of all the different ingredients, and it's not doing its beautiful swirl. It's not spiraling with like force and energy. And so then you've got this like sluggish, imbalanced blood, and that's when you can get blood clots. And so I think the platelets might be part of that. You've got the blood kind of like slogging along, and then a clot going into the brain. That's what a seizure is. The other thing is high blood pressure can cause damage in the brain, just like it can in the kidney. So I don't know if I totally answered that question.
I think so. Thank you. I might have also gotten confused, but I think that's what I was asking about. So thank you.
Mm-hmm.
Any other questions or comments? Mika has a hand up.
I really appreciate this presentation because I think I've understood like the components of preeclampsia, but not the why or how as well. So thank you. And I'm just gonna have this like vision always in my mind now of blood spiraling. I love that. Like that is so cool.
Look at this.
Okay, in a second, sweetie. Just a little.
Yeah, it's really cool.
Yeah, it is. But I'd love for you to, so my experience with home birth midwifery was like with my midwives visits, we would do, blood pressure and dip, test the urine every visit. But I'm hearing from my hospital-based clients that they're no longer testing their urine every visit. And they're just doing blood pressure, which kind of goes in line, I guess, with some of what Samsara is saying, and certainly not talking about nutrition. So I was wondering if you could, so like literally hospital-based clients are only getting that blood pressure like in prenatally as a way to check for preeclampsia, I guess, unless maybe they're concerned about something else. But how is like a home birth midwife, like how are you checking for these things or even trying to prevent, you're getting to, I know you got to it a bit of nutrition, but if you could just like talk about what that kind of care looks like.
Yeah, okay. So first of all, my hope is that I explained this as like a whole body metabolic picture. And I hope I did a good job of making that clear and simple. That was my goal for tonight. I don't know if I did a good job, but that was my goal. So what I do is I do want to say that I had a home birth midwife, a colleague of mine who I do respect, but who's much more of the like CPM professional paradigm. I'm way more of the like Ohana style traditional midwife, even though we're both CPMs. And she said to me, oh God, I don't even test their urine anymore. I just do it all through the blood work. So at least she's still looking at blood work to see what the protein is looking like, right? She's not just going off of blood pressure. And I had one of those kind of imposter syndrome moments, like, oh my God, I'm over here still testing the urine and you're so cool because you're just looking at blood work. But then I got myself together and I was like, no, we're still testing the urine because it's a pre sign. It gives us a little peek into what's going on. So we can see, and to be honest, I don't waste a whole lot of energy looking at the 10 different things in the urine, just looking at the glucose and the protein. If she's got glucose showing up on her strip, which is really rare with my clients, then she needs to cut down on how much sugar she's eating. And we'll talk about that. If she's got protein showing up, then she needs to eat more protein. That's what that means. If you have sugar, you need to eat less sugar. If you have protein, you need to eat more protein. And that's like, it's just our front line of defense. We can also do some blood work and double check and make sure, but the urine test strips are so easy. It's so non-invasive. You do it every time and you start to notice a pattern and just it clues you in. You also get to look at their urine. Is it dark? Is it clear? Is it well diluted? Is she drinking enough water? It's an intimate embodied practice. I also check blood pressure at every meeting, but mostly that's for me to get a baseline assessment. So I really understand. And then in labor, I'll have a better picture of like how her body is tolerating the whole process. And then you look at them, right? You look at their feet, you look at their face, like what's their swelling looking like? How does it feel? Does it feel normal or does it feel pathological? How long does it take for that finger press to fill back in? If it takes more than 3 seconds, that's a concern. So that touch, I always give the women I work with a full body massage at some point during their pregnancy. So we really establish that intimate relationship, and I learned so much about them and their preferences for touch and the way they relate to their body and stuff like that. So thank you for bringing up the whole diet thing. So there's a lot of different ways to talk about food and stuff, and the 5-finger eating that the Shphrah Circle and the Oakland Better Birth Foundation uses as a guideline to talk about food. I wholly endorse that. It's a great way, and I definitely do that with all my clients. And so if something looks off in their urine or in their blood work results, then I will talk to them about foods. I will talk to them about foods anyway, but we'll revisit that conversation. I do like certain supplements. Floridix is very, very popular with midwives and home birth mamas. And I also like Hemoplex. I think I've seen that work amazingly well. But of course, the diet sources are the easiest to absorb and also the least expensive, because Floridix is like, that's pricey stuff and it goes fast.
It's very expensive.
And some people are really supplement oriented. I'm definitely way more whole foods oriented. I really like herbal infusions, like an ounce of an herb in a quart of water infused for 4 hours. So I will talk about that. But if they seem very, very, they're more into supplements, then we'll talk more about supplements. It should be guided by like their sensibility, right? Because it's their practice.
Very cool. Any other questions, comments, feelings? How are you feeling getting this information?
Well, I see Kathleen has her hand up.
Unmute myself before I start talking. Thank you so much, Tara. I really appreciate your knowledge and perspective. And I think it just really highlights the difference in care, personal midwifery care as opposed to hospital industrial complex care. Because the big thing I hear from you is the time you take, the intimate time you take, where you're trying to, you are catching even the slightest differences in you know, the person's body, in the urine, in like in their energy, and like the way that doctors treat, it's just churning over. And if they're only checking blood pressure when they're in their office stressed out, then they're missing so much of the picture. And of course, then they just diagnose. And they're missing out on so much to prevent getting to a point of needing to diagnose. Like, that's huge. Like, people don't need to have preeclampsia. People don't need to have high blood pressure. And like in Joe's story earlier, it sounds like the client had some issues in previous pregnancies, and then, oh, their blood pressure is getting high, you know, very deep into labor. Like, people's blood pressure raises in labor, but did they pay attention to any of the other pieces to really warrant giving medication? Like, maybe it was warranted, but maybe it sounds like it wasn't, if there wasn't that knowledge of what is normal for the client.
Right.
What, like,
Right.
what is the, like you said, what is that baseline? And if you see those slight differences, okay, more protein. Like, I really appreciate the visuals you've given. I'm very visual. And I feel like that kind of like sticks in my head. And sugar, you know, or what you said, like low glucose or high glucose means less sugar, and high protein means you need to eat more protein. Like that makes sense. And why aren't physicians, OBs, or nurse midwives, like, why isn't that like a basic thing that they're sharing with people? Like, that makes no sense to me. I mean, the dollar signs behind things make sense, but I really appreciate that. And it just definitely highlights where things are lacking, and the need for midwives. So thank you.
It's really, it's always been a stunner for me that, you know, doctors dealing with high blood pressure, the first thing they tell you to do is to not consume any salt, to get off salt. So there's no talk about the kind of salt,
Right?
but
That's
just no salt.
Preeclampsia.
So let's make people worse. Let's make it worse.
And thank you for sharing about the differences in salt also. I didn't get that before.
And I was just thinking, doctors don't even know that about salt. Like, they're not learning those things.
They're not taught nutrition.
And even if you take nutrition at a mainstream school, like, and not a holistic approach, there's other things you're still potentially not learning. But it was a trip, because even in my nutrition class when I was in grad school for social work, she talked about, I remember the instructor talked about cutting the cord too soon. But they're teaching that in nutrition class.
Exactly.
Because she talked about how babies are iron deficient. And she was talking about that from cutting and not allowing the nutrients to go through. But I was like, I had a friend in medical school who never heard that information.
Oh.
Never. One of our beautiful clients was a pediatrician a couple of years ago. Kathleen's nodding her head because I had the honor of doing this birth with her. It was right before the world shut down, wasn't it, Kathleen? Oh, yeah. Anyway, beautiful birth. And we did powerful work with that beautiful young pediatrician, because she decided that she was going to have a home birth, which the other doctors stopped talking to her and told her how dangerous and how irresponsible she was, because she was going to have her baby at home. Because her doulas were the only people in her whole pregnancy who discussed nutrition with her. And she was like, I'm a physician. And, I haven't had this conversation. And that's for real. And she had the most sublime, mystical, magical home birth of her powerful little precious daughter. And I'm just glad that, she's been in touch with me, and we've been talking about the goddess, and I've been sending her books and stuff. So it's like a whole opening of this beautiful person's third eye to go, oh my God, there's more to life than just what I see in front of me. There's so much more. Physics tells you that if you listen to it, right? So I want to make sure that if there's something else that somebody wants to say or feeling, comments, I want to do that. So I want to make sure we have time for everybody to check in. And I just want to say some closing things before we stop recording. So does anybody have anything more they want to say or ask? Please do. Cool. So let us thank our sister, Midwife Tara. You rock, yes.
Thank you so much. I appreciate it. Thanks, guys.
It's so we have this diamond in our practice, like our own midwife. It's so nice. I want to point out, because I have to, that doulas do not diagnose or treat nothing. We don't do that. They get mad at us. Then they might want to put somebody in jail. And then that's not where I want any of my doulas to ever be. We are allowed to teach the hell out of everything. Right? And that's very different from saying to somebody, you have preeclampsia and you should do this. Right? So it could be a situation where the doctors are saying the person has preeclampsia, and you just give them all this great information about preeclampsia that you have gotten. This video will eventually be on our Better Birth TV YouTube channel. Share the video with them, hear the conversation. People like Midwife Tara, they can diagnose and treat things. They don't go to jail for that, at least not yet. So, that's what's important about, having someone who has the ability to call a thing what it is. But we can teach the heck out of this, and we can inform our clients about this, and we can refer them to good books about pregnancy nutrition. There's tons of them out there. And if we need to make, like, Nourishing Traditions is the first one that pops in my mind. That's an amazing book. There are wonderful books out there to help folks with eating. 5 Fingers is a good way for them to put it all together. So we get to teach the hell out of all that stuff and support our pregnant people in making good choices, and having better outcomes for their babies, and not having to be afraid. We want to teach people what's the appropriate way to take a blood pressure. Very often, the way the blood pressure is taken in the medical clinics is foul and wrong. If in our student portal, there are a couple of infographics, I believe. Kathleen, did you find them? Yes, that are posted there to show what's correct way to take somebody's blood pressure, and so that the mom or birthing person can insist that their blood pressure be taken correctly. They don't have to just accept the busy nurse on the phone doing the thing, and then that's a number that can affect how their pregnancy is guided through that system, right? And then we have bozos, and I'm just going to use that terminology because there was a doctor who told one of my clients recently, you're African American. It's a matter of time before you develop preeclampsia. There ain't no science there, right? So hopefully your clients learn enough from you to know that they need a new doctor. Anyone who says anything like that is racist and not scientific. Bye-bye. Bye-bye. You get to be the doula to say, perhaps, have you thought about finding another doctor? It is much better to do that than to to be trying to teach somebody who's clearly not willing or wanting to be taught. We don't got time for that. And Black women have already spent way too much time educating patriarchal systems. We just want to have our kids in peace, in love and light. Thank you. So again, big thanks to Midwife Tara, and we are going to stop the recording portion of things. Got some applause. And how do I do it?